This presentation is going to be over oral hygiene of changing dentition. Today we'll have Clint Stewart, Jared Haslam, Nick Eccles, Morgan Pitcher, and Benjamin Lobby presenting. Our goals are to help educate on common oral health problems such as cavities and periodontal disease, otherwise known as gum disease, to instruct on the use of various oral hygiene aids, discuss teeth replacement options, and to help discuss various resources for the population to seek out for treatment. Periodontal disease is the loss of bone surrounding the teeth and recession of the gum tissue due to chronic inflammation. Caries, otherwise known as cavities, is the decay and breakdown of tooth structure. In the diagrams below, you can see the progression of each of these diseases. Listed below are a few of the resources for Medicaid and Medicare. The different avenues for seeking dental work are private practice, hospital dentistry, and the School of Dentistry in the Salt Lake area. Starting in 2008, the School of Dentistry has been a provider for the Medicaid blind and disabled. This covers most dental procedures. Most Medicare coverage does not include dental. Here at the school, we have the NORDA Foundation, which is the Oral Health Assistance Program, which can help those who do not have dental insurance. The SB 274 law has enabled the dental school to partner with the University of Utah Public Hospital System to provide care to people who are blind or have disabilities at multiple off-site ambulatory care centers that include both dental clinics and operatories. This slide shows the characteristics of gingival health. Gingival color will usually be coral pink with health. The consistency will be firm and resilient, the contour scalloped, knife-edged margins, and the surface texture will be either smooth or stippled. In the picture, between the front two teeth, you can see the stippling that's seen on the gingiva. Probing depths will usually be less than 3 millimeters. This slide shows the characteristics of gingivitis. The color will be red, otherwise known as erythematous. The consistency is soft and tender. The contour is bulbous, ballooned, or rolled margins, and the texture has no stippling and bleeds easily. This is the first step to periodontitis. There is no bone loss, and the pockets are between 2 and 4 millimeters. Other characteristics of gingivitis can be bad breath and a metallic taste in the mouth.
All right, now we're going to take a look at periodontal health, which is dealing with your tissues and bones surrounding your teeth. So when you have a healthy periodontium, your bone is just below the cemental enamel junction, right below your teeth in these photographs over on the left, and there's no bone loss. Usually with these type of individuals, we have a probing depth between 1 to 3 millimeters. In stage 1 periodontitis, we have loss of the clinical attachment around the tooth, and that's usually about 1 to 2 millimeters. Then radiographically, that equates to around 15% of bone loss. This is mostly horizontal bone loss, and the probing depths here are around 4 millimeters or less, and a characteristic of this stage is the gingiva, or your gums around your teeth, will start to bleed. The advanced stages of periodontitis are stage 3 and 4, and that's where you have even a bigger clinical attachment loss, and you're losing up to 50% of the bone supporting the teeth and the surrounding structures. You'll have deep probing depths of 6 millimeters or more, and you'll have vertical bone loss. And this is where we can see tooth loss due to bone loss. There's going to be bleeding and pus, and this can be sometimes painful or it can be asymptomatic. Since we're talking around the tooth itself, we'll take a look at recession, which is also called clinical attachment loss. This is where you're going to have sensitivity due to exposed dentinal tubules, exposing the nerve underneath or in your tooth. This can be caused from aggressive brushing, plaque buildup that's causing the tissues to recede, than other local irritants. So you may be thinking, how do we treat periodontitis? And it's important to note that there's no cure. We can only help maintain and relieve the inflammatory response of the mouth. So we try to halt the progression of bone loss. We try to stop that immediately by performing a deep cleaning, and hopefully that regains long junctional epithelium and reduce the pocket size in return. And we help prevent plaque accumulation in these pockets with good oral hygiene habits, and again, coming into the dentist.
There are many different types of oral hygiene aids, and everybody has their own preferences as far as what they want to use in their daily routine. Those include toothbrushes, floss, different picks, floss picks, water picks, mouth rinse. You'll hear all of it. This slide just shows a few of the different types of examples. As if there weren't enough options for you, your toothbrushes can be broken down into either electric or manual toothbrushes. Your floss can be broken into traditional floss picks, interdental brushes, and different water picks. The consensus recommendation is for people to brush their teeth for 2 minutes twice a day with a toothbrush that has soft bristles. This can be either manual or electric. You just want to ensure that the bristles are soft. You also want to replace toothbrushes every 3 to 4 months, or even more often if the bristles are visibly matted or frayed. Either manual or power toothbrushes can be used effectively. Interdental cleaning helps remove debris in interproximal dental plaque, which is the plaque that collects between two teeth. Dental floss and other interdental cleaners help clean these hard-to-reach tooth surfaces and reduce the likelihood of gum disease and tooth decay. Use of an interdental cleaner like floss is an essential part of taking care of your teeth and gums. The U.S. Department of Health and Human Services reaffirmed flossing as an important oral hygiene practice in a 2016 communication to the American Dental Association. Home oral care recommendations from the ADA are based on data from the clinical studies and systematic reviews. While general recommendations may adequately address the needs from any patient, a dentist may tailor home oral care recommendations to fit the individual patient's needs and wants. Home oral care is an important contributor to oral health, and it can help lessen the need for extensive dental intervention in the future. There are also mouth rinses that can help with oral health. They can either be cosmetic or therapeutic. Therapeutic mouth rinses are available both over the counter and by prescription, depending on the formulation. There are therapeutic mouth rinses that help reduce or control plaque, gingivitis, bad breath. Your diet plays a role on the amount of dental caries that develop in your mouth. The consumption of sugary and acidic foods and/or beverages has been associated with an increased risk of developing dental caries. There's also a complex nature of periodontal disease that makes it difficult to determine the relationship with diet and nutrition. But we do know that frequent consumption of acidic food and beverages is the associated risk with increased tooth wear. As we already stated, the home oral health care is important to use as it can help lessen the need for extensive dental intervention in the future.
At this point, we're going to move on to things that's a little more exciting about how we can replace the teeth that we have lost and what we can do to restore our oral health condition. Earlier on in this presentation, we talked about decay that causes caries or also known as cavities. There are various ways to restore these carious lesions, and this is the most conservative way and offers various options. The best option is a gold inlay, which is seen on the left. The issue is with a gold inlay is, number one, it's expensive, and number two, it's not quite as aesthetic because it's not tooth colored, but it is known to last the longest and to be most like the natural dentition. The next option is a silver amalgam, which is seen on the right side. When compared to gold, they don't last quite as long, but they do have a much longer history than composite. That being said, silver amalgams do have their downfall. Number one, they're not so aesthetic as seen, and number two, they can either fall out or can also cause large fractures in the tooth, which would lead to either a crown or extraction of that tooth. composite is a very good and aesthetic option that looks the most like the tooth. That being said, its downfall is in the adhesion between the composite and the tooth itself. As this adhesive begins to break down, the composite has a leaking part where bacteria can enter into and cause recurrent decay. This decay has to either be restored by doing a new composite or doing something more invasive like a crown. After removing the decay, oftentimes there can be very little tooth remaining. At this point, a crown is indicated. This is because the crown wraps around the entire tooth, holding the tooth itself together. A crown is often indicated as well when there is a fracture in the tooth. Again, this crown wraps around the tooth and holds the tooth together in preventing further fracture of the tooth. If the tooth fracture continues, it often will lead to something that is unrestorable and the tooth will have to be extracted. Another reason for a crown is to either restore or to put a tooth on an implant or to be part of a bridge, which we will talk about later. Another great reason for an implant or for a crown is to cover a tooth that is badly discolored and for aesthetic reasons would like to either change the shape of the tooth or the color of the tooth to increase aesthetics. If a tooth has to be extracted, we have various reasons to replace that tooth that is missing. The first option, and the most financially achievable, is a removable prosthesis as seen in these images. They have pros and cons. There's also two options. The upper option is an acrylic version, which is not as strong and is often used as an aesthetic replacement or as a temporary until we do something more permanent like bridges or implants. The bottom version with the metal is more of a permanent solution with a removable apparatus. The pros are that it is cheaper and faster, and it can maintain the space for something in the future if we want to move to an implant or a bridge. The cons is they are often not as comfortable given in this scenario where the palate is included in the prosthesis. They are also more difficult to eat with as they can have some movement, although they should be very stable. The other con is that they are much harder on the remaining teeth. As you can imagine, as we eat, there's flex on this appliance, and as it flexes and pulls, it will actually begin to pull that tooth out that it is attached to. The other downfall is that it must be removed every single night and cleansed very, very well, or you can begin to have oral disease. Another option to replacing missing teeth is a bridge. As seen here on the right, we have replaced two teeth on two abutment teeth that are holding them. There are pros and cons to this option. Pros is that they are much more retentive and stay in place than the option seen before, which was the removable appliance, making them easier to chew with. They can also be cheaper than implants. This is not always the case. That depends on if the adjacent teeth need crowns or not. The cons to this appliance is that when it fails, it goes from a 2-tooth problem to a 4-tooth problem. The explanation to that is that we were missing 2 teeth before, and they're sitting on 2 other teeth, and if one of those abutment teeth fail, we now include 4 teeth instead of 2. Another con is just like we described, it is actually harder on the remaining teeth because the abutment teeth are trying to make up for the 2 teeth that are missing. It is also very challenging to clean around. You have to thread floss underneath it and clean out the food debris after each meal. This being the case, they do not last as long as implants. Another option to replacing teeth that are missing is implants. There are pros and cons to this option as well. The pros often outweigh the cons in this scenario. The pros for this is that each tooth is individual and will not damage the tooth next to it. It is also the most aesthetic because the teeth are not connected. It is easier to clean around because you can get the floss between each tooth. Implants can often be used also in the future to restore teeth as more teeth are missing, and we will see that in future slides. The cons is time. You must allow for healing to happen around the implant and for bone to integrate to each implant. Implants can also fail like any other tooth, so oral hygiene is a must, just like any other option.
Now we would like to discuss options to address when more than one or two teeth are severely damaged and broken down. Many of you may know someone who has had dentures made in the past. Dentures are indicated for complete dentition loss. This is the most cost-effective way to restore aesthetics. However, these do have limited function, as you may have heard. In these situations, all the teeth must be extracted, all remaining teeth must be extracted, and this prosthesis is made to replace the missing teeth. There's a couple different options here. You can either go with an immediate denture, following any removal procedures where you can actually have the denture fitted the same day that the teeth are removed. This is a great option, so you do not have a period of time where you don't have any teeth. However, these usually have to be realigned multiple times as the tissues heal and the bone resorbs from those extractions. The denture will become quite loose and will need to be refitted and recontoured to the healed mouth or healed gingiva. Conventional denture is waiting for a period of time after extractions, and then the impressions are taken in the office and the denture is fabricated. It is common with a conventional denture that you still have to come back in for follow-up appointments to check for sore spots or to make any adjustments to make the denture fit ideally. One of the most profound changes to dentures in recent history is the idea of using implants that are actually placed into the bone, both the maxillary and mandibular bone, and those are used to support the implant. There's a couple different types of devices, and we'll discuss both. This specific slide deals with implant-supported dentures. These are also known as snap-in or snap-on dentures. They have a retaining clip that actually snaps. The denture will snap down into place, and that will help support the denture. These are great specifically for mandibular dentures. It helps the denture stay in place. It helps improve function, and they're easily removed for cleaning at home. These devices do have maintenance. The clips and snaps that are used do need to be replaced occasionally as they wear out. But again, it's a great option to improve function, to improve the fill for the patient as well. One thing noted with these implant supported, you do need to have adequate amount of bone to support the implants, and not every patient is a candidate for this without additional bone grafting. The second style of implant denture is what's known as an implant retained denture. Implant retained dentures are fixed. There's actually screws that will go through the denture body and screw these down into the housing that's connected to the implant. These provide the absolute most stability with a denture. It's the most natural fill besides a natural tooth, of course, for people with dentures. The jaw actually absorbs the force from chewing, and these are fixed into place. And so eating your favorite foods is not an issue. It reduces pressure on the gums, so we see fewer sore spots. Multiple implants are required for these, and that requires a healing period, but there are options for temporary or provisional devices during that healing time. They stay fixed in your mouth, and you will need to receive routine care to go into a dentist for removal and cleaning. And that's really important as bacteria and plaque can build up underneath the surface of the denture. As we've discussed at length, regardless of the treatment modality that you decide to receive or that is indicated, oral hygiene is an absolute must. Regardless of the skill of the dentist, the patient needs to be equally invested in cleaning and caring for each of the treatments we've discussed in this presentation. And these dentures or these implant supported or retained dentures are no different. The oral hygiene for a denture is slightly different, but nevertheless equally important. We found this step-by-step guide to cleaning a removable oral appliance. This would apply for more of a conventional denture or an implant-supported denture, but it goes through step-by-step. This would also go for a removable partial denture as well. All of these devices can accumulate plaque, they can accumulate bacteria buildup, and it's important that these are cleaned on a routine basis. So rather than reading the entire slide, the gist is you need to take these out, you need to clean them. Here's the step-by-step instructions using warm water, how to get the denture out with gentle pressure without prying too much and causing damage to either the denture or the surrounding tissues. You want to rinse that denture under warm water, again, to get rid of large debris. Use of a denture brush or a soft regular toothbrush is really important. You can use regular water to clean it. Denture paste, cleaning paste, is great. We advise against using regular toothpaste because those have actually pretty strong abrasives that can damage these prostheses. You'd want to remove all the adhesive from both your mouth if you're using a denture paste, and the backside of the denture as well, to make sure that you can clean all surfaces of this. They make tablets that you can soak these dentures in overnight that help to break down the built-up debris, which are great. And all these instructions are indicated and important to ensure that any treatment modality lasts as long as possible. In conclusion, I would like to offer our sincere gratitude. Thank you for your time. Thank you for sticking with us and listening. Hopefully this was beneficial and you were able to learn something along the way about treatment modalities, about disease progression. We'd also like to apologize that we weren't able to be with you in person. I know we are planning future events where we'd love to answer questions, to be more interactive, to make this a little more exciting. But in conclusion, again, thank you so much for your time.